Hello everyone, I am Dr. Swati Sreyashi dealing with developmental disturbance of oral lymphoid tissue, angiolymphoid hyperplasia with eosinophilia, जिसको हम लोग epithelioid hemangioma, histiocytic hemangioma, pseudopyogenic granuloma, papular angioplasia, inflammatory एंजियोमेटस नोड्यूल्स भी कहते हैं। यह है एक अनकॉमन आइडियोपैथिक कंडीशन, अनकॉमन आइडियोपैथिक कंडीशन that present with isolated or group, that present with isolated or group or grouped plaques or nodules in the skin, groups plaque or nodules in the skin of the head and neck, the skin of the head and neck. Most patients present with lesion in the periauricular region, periauricular region, periauricular region, forehead and or scalp, forehead or scalp. It is marked by a proliferation of blood vessels. It is marked by a proliferation of blood vessels with enlarged endothelial cell, with enlarged endothelial cell. Blood vessels are accompanied with inflammatory infiltrate that include eosinophilia. Blood vessels are accompanied with inflammatory infiltrate that include eosinophilia. Lesion is benign, may be persistent and difficult to eradicate. Lesion is benign. Lesion is benign, may be persistent and difficult to eradicate. Difficult to eradicate. It may be benign or may be an unusual reaction to varied stimuli, including trauma. Varied stimuli including trauma. It shows same similarity with Kimura disease. Same similarity with Kimura disease. Feature. Common in female, common in Japan and most common in Asian. Rare in elder patients and non-Indian pediatric patients. Although it may be benign tumor, numerous factors suggest it as an unusual reactive process. Condition may be multifocal. Hyperestrogenic state. Like pregnancy or oral contraceptive. use faster lesion growth. Use faster lesion growth. Approximately 20% of population have blood eosinophilia. 20% of population blood eosinophilia. Patient presents with expanding nodules or group of nodules, usually in vicinity of ear, appear as dome-shaped. Dome-shaped. Appear as dome-shaped, smooth surface papule or nodules. Smooth surface papule and nodule. It may be associated with pain or pruritus. Associated with pain and pruritus. Uncommon symptoms is pulsation and spontaneous bleeding. Uncommon symptom is uncommon symptoms is pulsation and spontaneous bleeding Most lesions are 0.5 to 2 centimeter in diameter with range of 0.2 to 8 centimeter. Diameter range is 0.2 to 8 सेंटीमीटर. अब हम लोग ये फिगर देखेंगे. Now in differential diagnosis में क्या आता है? ग्रैनुलोमा फैसिली, इंसेक्ट बाइट्स, पायोजेनिक ग्रैनुलोमा जिसको हम लोग ग्लोबुलर कैपिलरी हेमेंजियोमा कहते हैं, एंजियोसार्कोमा, हेमेंजियोएंडोथीलियोमा, हेमेंजियोमा क्या है? ग्रैनुलोमा पैलेस, इंसेक्ट बाइट, पायोजेनिक ग्रैनुलोमा जिसको हम लोग ग्लोब्यूलर कैपिलरी हेमेंजियोमा भी कहते हैं, एंजियोसार्कोमा, हेमेंजियोएंडोथीलियोमा, हेमेंजियोमा. अब हम लोग इसके हिस्टोलॉजिक फीचर में आते हैं. Proliferation of small blood vessels. Proliferation of small blood vessels, many of which is lined by endothelial cells with uniform ovoid nucleus and intracytoplasmic vacuole. Endothelial cells have cobblestone-like appearance. Endothelial cells have cobblestone-like appearance. Eosinophilia typically comprise of 5 to 15%. 5 to 15%. Rarely account for as 50% of infiltrate lymphoid aggregate with or without follicle formation. Lymphoid aggregate with or without follicle formation. With or without follicle formation. Now in treatment, not mandatory. Intralesional corticosteroids. Intralesional corticosteroid steroids and eradication have been employed but not very effective. But not very effective. So after that we do surgical removal of lesion. Surgical removal of lesion demonstrate best result. They may recure. Thank you.